Again, everyone, my name is Rod Nepps. I want to thank each and every one of you for taking time out of your busy schedule to be a part of this special webinar. My person I will be introducing you today is by the name of Joni M. Jones. Joni is a registered nurse. She's the owner and founder of the company called The Perfect Balance. Joni specializes in when it comes to anger management, also addiction. Tonight she's going to be talking about the challenges dealing with addictions. Maybe you know someone, a co-worker, a friend, a family member that you want to help out. Maybe it could be yourself. So Joy is going to share with you some things you can do in order to help them overcome those challenges they may be facing. Joni, I turn it over to you.
Yeah, hi, Rodney. I'm very happy to be here today. We're going to talk about challenging addictions related to alcohol addiction and opiate addiction. And again, yes, it's so easy to talk about physical health, not so easy to talk about the emotional side of health and especially addictions because there's a stigma associated with it, but hopefully through education we can start getting rid of that stigma and do something about this disease that is really running prevalent in the United States. Rodney, nobody grows up saying, I want to be an addicted individual. Addiction begins with voluntary behavior. So there's that first use. And there's that euphoric response, dopamine levels go up. But when the individual stops, they experience an adverse reaction. It becomes so hard to stop because they don't want to feel the effects of that drop in dopamine if in fact they are addicted. 3 years of abstinence of a drug by research is needed to get balance back of those dopamine levels. Those who abuse drugs become used to the increased dopamine levels from the drugs. When the drug effect decreases, so do the dopamine levels, and this leads to increased sadness, depression, and cravings. People with addiction usually do not care about consequences. They are on a one-way street. The love of their life is the drug that they are addicted to, and they are just trying to get that same response that they had when they first tried the drug. So unfortunately, people take it very personally. However, this is part of the maladaptive or undesirable behaviors that we see because of the addiction, and not necessarily is the person themselves. Excess stimulation of neurotransmitter levels by drugs starts what's called a downregulation. This decreases the sensitivity of receptors, which decreases the number of receptors and decreases the amount of neurotransmitters. What are neurotransmitters? Neurotransmitters are small molecules whose function is to transmit nerve signals, which are known as impulses, from one nerve cell, known as a neuron, to another. They are the chemical messengers which neurons use to tell other neurons that they have received an impulse. So let's look at dopamine. This is known as the drive to pleasure. Neurons utilizing the neurotransmitter dopamine have received a lot of attention because of their role in a variety of disorders, ranging from things like Parkinson's disease to ADD and ADHD, schizophrenia, and also to drug abuse. Norepinephrine and serotonin transporters play important roles in an array of behaviors, including sleep, appetite, memory, and mood. So changes in serotonin uptake sites have been associated with major affective disorders, particularly in depression. So if you look closely at this slide, you can see the pathophysiology or the abnormal things that happen when norepinephrine and serotonin, also the dopamine levels, fall out of balance. When we take nutritional support such as essential vitamin Bs or vitamin C, just because they enter the blood, it doesn't mean they are addressing the oxidative stress or free radical damage on the cellular level. The brain is the organ with the most free radical damage, yet it has the least antioxidant support. And that's why, Rodney, I'm a strong advocate of Dr. Prasad's research, where he found the type of vitamin E, which is an antioxidant, that is able to pass that blood-brain barrier and give the brain the needed support. He has a CQF standard, which is patented, and that allows the nutrition we need on a cellular level. It's just not about taking the vitamins and the antioxidants haphazardly in like a cut and paste approach. It's about the right combination in the right quantity or ratio to each other in the right form, the isoform or the metabolized form in which the body can use. And that's what the CQF standard is. The result of downregulation is tolerance, and that means it takes more of the drug to get the same response. We look at the effects of opiates on the brain. Opiates change the limbic system, and that controls our emotions and increased feelings of pleasure. Opiates also change the brainstem. That's the area that controls the automatic body functions. And opiates also block pain messages transmitted by the spinal cord from the body. So we look at the effects of opiates. We have short and long-term effects just from the heroin use. So short-term effects, yep, they can get that rush, but they can also experience depressed respirations, clouded mental functioning. Some people get nauseous, they're vomiting, there's a suppression of pain. We see that with methadone, which is an opiate. We use that a lot in pain management. But unfortunately, if a woman is pregnant and she's using heroin, she can have a spontaneous abortion. Then if we look at the long-term effects, yep, there's the addiction. There's infectious diseases, for example, HIV, AIDS, hepatitis B and C. We're looking at collapsed veins, and the immune system is very compromised. We see a lot of bacterial infections and abscesses, infection of the heart lining and valves that can become very life-threatening, and also an individual can experience arthritis and other rheumatologic problems. Also with addiction, we have to look at alcohol. And alcohol initially induces sleep. Then with continued use, it decreases its sedative effects, and we call that a rebound effect. So we start to see individuals beginning to wake up at night. We've heard of alcohol effects on the liver. There can be fat accumulation in liver cells. It's also known as a fatty liver. We can have hepatitis, which is an inflammation and destruction of liver cells. Cirrhosis, which causes a scarring and shrinkage of the liver. Many people don't know that cirrhosis can lead to cancer. And then, of course, we can see liver failure. Then there's also something we refer to as hepatic encephalopathy. This is a serious brain disorder that can cause changes in sleep patterns, mood, personality, attention span, anxiety and depression, that shakiness and hand flapping, and sometimes coma and death. There are so many effects that alcohol has on the brain. We can see memory loss and blackouts, exaggerated emotions, problems with muscle movement, decreased sexual arousal and performance. And we could also see changes in the heart rate, temperature, and breathing that can lead to death. In fact, we see a lot of this on college campuses when there's that alcohol intoxication. People are having sudden death related to that. There can be brain shrinkage, learning difficulties, slowing the growth of new brain cells, more sleep impairment with sleep apnea and decreased REM sleep, and that REM sleep is where we need for repairing to take place in our body. There's something that's called peripheral neuropathy. These are these pins and needle sensation that we might get in our feet or in our hands, and this can lead to a loss of sensation. Also, something known as delirium tremors. Some might have heard of DTs, and this is during the withdrawal process. An individual can go through a state of confusion accompanied by that trembling or those tremors, hallucinations, and gait disturbances. When people are experiencing that psychosis, it's really not a good thing for somebody to watch, even as a medical professional. We can say that alcohol really affects every organ in the body, whether it's the pancreas, the kidneys, the heart, the bones and joints, the lungs. In fact, when people experience pancreatitis, That is so painful, and usually opiates don't even help in assisting with the pain management. There's also something that's called thiamine deficiency. Thiamine is a vitamin B1, and the brain depends on that particular vitamin. When it's deficient, it can lead to something called Wernicke-Korsakoff syndrome, and that's where we see mental confusion, paralysis of the nerves that move the eyes, and difficulty with muscle coordination. Korsakoff's psychosis is a persistent learning and memory impairment. Some people may know this as wet brain, and the sad part about this is usually when people progress to this level, there's no recovery from that. There's 4 basic components of addiction. One of them is pleasure. And in 2004, there was a review study from substance use and misuse. The results showed that the person's biological, psychological, and social interactions combined were the result of their pleasure. And that shows us that their pleasure response is very unique to the individual. The second component is loss of control. In 2004, neuroscience biobehavioral reviews defined drug addiction as a chronic relapsing disorder characterized by compulsive drug intake and loss of control over that intake. And of course, there's that compulsion related to the constant seeking for a particular drug. The fourth component is denial. In 2002, the Journal of Neuropsychiatry and Clinical Neurosciences found a strong correlation between persistent denial and an increased impairment of cognitive abilities such as executive function, verbal memory, visual interference, and mental speed. The Journal of Psychoactive Drugs found in the same year that denial was an underestimated component of addiction, which often goes unrecognized. There's simple addiction. That's a superficial physical dependence. It involves physical craving and withdrawal symptoms when removed, but this can be overcome with determination and conviction by the individual. But then there's the complex addiction. This has an emotional hold on a person stronger than dependency. Their needs are physical. They attempt to use the product in a way to change or repress their inner psychological moods. They're out of control, and this is treatable only with the help of others. It requires long-term treatment and intervention with drug abstinence, personality change, and self-help group participation. Willpower and self-hypnosis do not work well with complex addiction. I have to talk about codependency. It's an act of taking responsibility for another person's behavior. A codependent person may be psychologically dependent, basing personal self-esteem on being able to help or rescue the person from addiction, while trying to protect them from the consequence of their behavior at the same time. We see this a lot with parent to child and spouse to spouse. What can we do? First of all, a person has to admit that addiction is a challenge, and they have to find their reason to quit. They have to be motivated. There's demands just in life in general, but the amount of demands that are going to take place when you're trying to combat an addiction is great. It's important that the person who has challenges with addiction becomes educated on it. Nearly all persons with addiction believe they can quit on their own. They feel like they have all the answers. They know what to do. Yeah, there are some that are able to refrain short term, but most fail to achieve long-term drug abstinence. And then there's planning. We need to develop a plan, start the plan, revise or change the plan as needed, and then practice the plan. It's important to put joy and include it back into the person's life, because I ask so many people, how many of you have taken joy out of your life? And so many people raise their hands, it's unbelievable. But joy is unique to an individual. What makes me happy may not make another person happy, so we have to define it. And with all the demands, If we just keep putting those demands in like a air into a balloon, it's going to pop. Just like a cell phone needs to be recharged when it runs out of battery, so do we. So that joy allows us to take some of that air out of that balloon so we can face more of the demands that are placed upon us. We practice our plan and watch a new habit form. Developing a plan can include multiple things. First of all, sometimes we have to learn new skills. Many people don't know about mindfulness. As humans, we're on autopilot. We don't live in the moment. We're just doing things and we're not even thinking about it. So learning mindfulness allows us to be more aware of what we're doing and how we are responding to things. And then, of course, we may have to learn the skill of identifying our emotions. We can be frustrated, disappointed, sad, and that can all come out as anger. So unless we identify the underlying emotional responses, it's going to be difficult to problem solve that. A lot of people don't know about relaxation techniques, and if we've never been shown them, then we have to learn them. And I see so many challenges related to effective communication. Many people don't know how to say no. They say yes when they want to say no, and that doesn't make their needs known. Also, they expect other people just to know what they're thinking. But I don't know what other people are thinking, just like they don't know what I'm thinking. So we have to learn effective communication. And then some people may put in their plan quitting with a partner. This becomes very helpful because when one feels a little bit weak, the other person can help them stand up. And when the other one kind of like falls down, then that person can help them stand up. So quitting with a partner isn't necessarily a bad idea. It's important to identify triggers, write them down, because then you can start to rehearse them. And then when you're rehearsing them, you can learn how to respond for positive outcomes. Listen to negative self-talk, because if you have that inner voice that's talking negatively and that's the way you're thinking, that's going to affect the way that you feel and the way that you respond. So what we do have control is changing that to positive self-talk. And remember, what you feed into will grow. So we want to grow into that positively feeling so that we can be more assured that we're going to reach the goals, more confident, raise our self-esteem. And then again, there's treating those underlying conditions, whether they are a loss, a grieving, an underlying shame, a depression, a bipolar disorder, also any physical medical conditions. So it becomes very important to learn how to support your body. And I've learned to support my body through cellular nutrition. It's important to get all the way down to the cell because cells build tissues, tissues build organs, and organs build systems. So when we're talking about any type of an organ, we need to get back to the foundational level and support at a cellular level. We need to get back to that REM sleep. This is where healing takes place. And we need to fight the free radical damage and the oxidative stress. Oxidative stress is essentially an imbalance between the production of the free radicals and the ability of the body to counteract or detoxify their harmful effects through antioxidants. So what we want to do is we want to reduce inflammation for any associated pain. One thing about the cellular nutrition that I learned about, it's able to cross that blood-brain barrier. And if you can go back and remember all those neurotransmitters that I talked about, this is what supports the neurotransmitters.